Hi guys, Jason here, and welcome to Med School Hero, where we simplify medicine one concept at a time. Today we're going to look at important foundations in anatomy, the anatomical position, planes, and the language we use to describe the body. Think of it like the map or the GPS of medicine. Without it, we'd be lost. Okay, so fundamentals, what is anatomy? Anatomy simply means the study of the structure of the human body. It has three main branches. First off is gross anatomy, which studies all about body structures we see with the naked eye. Structures like muscles, bones, and organs. Next off, we have microscopic anatomy or histology, which studies cells and tissues under the microscope. So we'll see tissue sections like this under the microscope. Next off, we have developmental anatomy or embryology, which studies how we go from a single cell zygote to a fully formed human in the uterus. Okay, fun stuff now. The anatomical position. To avoid confusion, we describe the body as if it's always in the same standard pose, standing upright, facing forward, arms by the side, palms facing forward, and feet together. And we call this the anatomical position. And in every description in anatomy, we are assuming this posture, no matter how the body is lying. Okay, anatomical planes now. Imagine we cut the body into slices with glass sheets. First slice, we call it the sagittal plane, which divides the body into left and right. If it's exactly in the middle, we call it the median plane or mid-sagittal plane. And when it's off to the sides, we call it the parasagittal plane. Okay, coronal plane is the next one. Coronal plane divides the body into front and back. Front in anatomy we call anterior, and back we call posterior. Keep that in mind. Okay, now we enter the transverse plane now. The transverse plane divides the body into upper parts, which we call superior, and lower parts, which we call inferior. And one thing to note about this word transverse is that it divides, it means that it cuts across horizontally. So any structure that is cut across horizontally is like a transverse section. Okay, directional terms. These are compass points of anatomy. First up is superior, which are structures towards the head, and inferior structures towards the feet. In developmental anatomy, we also see cranial is towards the head and caudal towards downward tail end. And we use cranial and caudal in embryology because the embryo isn't really standing erect yet or mature. That is why we use cranial and caudal. So anterior, remember, structures in the front, posterior, structures facing the back. So we also have another term for this. We call them dorsal and ventral. Ventral are structures facing towards the front, and dorsal are structures facing towards the back, like the butt is dorsal. Okay, so let's continue. Medial and lateral. The medial structures are structures that are closer to the midline, and lateral structures are structures that are further away from the midline. For example, the ear is medial when compared to the hand, and the hand is lateral in relation to the ear. Now let's talk about dorsum. The dorsum of your hand is the back of your hand, and the dorsum of your foot is the top of your foot. We also have palmar, which is the palm of your hand, and plantar, which is the sole of your foot. Okay, superficial and deep. Superficial structures are structures on the surface, while deep structures are structures deep to the superficial structures. For example, the skin is superficial in relation to the muscles, which are deep to the skin. Okay, so sometimes we combine some terms for a more precise description of structures, and we get terms like anterosuperior, which are structures towards the front and upper side. For example, the chest is anterosuperior to the butt. And then we have posterior inferior, which are structures that are towards the back and lower side. For example, the heel of your foot is posterior inferior to your knee. Then superomedial structures are structures that are towards the upper side and closer to the midline. For example, the ear is superomedial to the shoulder. Then inferolateral. Inferolateral structures are structures towards the lower side and away from the midline. For example, the hands are inferolateral when compared to the ear. But we don't use opposites like mediolateral or superior inferior. Those are just wrong. Instead, when we use the right combinations, it will make our descriptions more sharp and accurate. Finally, let's talk about laterality. Laterality describes one side versus both sides. For example, unilateral structures are structures on only one side, like the spleen is on one side, so it's unilateral. Then bilateral, which means on both sides, like the kidneys are bilateral. Next, we have contralateral, which describes structures on opposite sides, like the left ear is contralateral to the right shoulder. Then we also have ipsilateral, which describes structures on the same side, like the right ear and the right shoulder. So that's it, guys. We've learned the basic language of anatomy. We've learned positions, planes, directions, and laterality. With a little practice, and once you are comfortable with these, you'll be able to follow and describe structures in anatomy with clarity. Next time, we'll start applying this to real anatomy. If you found this helpful, don't forget to like and subscribe. Let's study smarter and not harder. See you in the next video. Bye.